Most institutions, and for ours, studies that we were doing in supportive care and cancer were put on complete hold. And some studies that we were looking at to really simplify antiemetics in many settings and really hone in and improve, we've had to put that on hold. There were some interesting areas that we were looking at where we were trying to predict using some very interesting information to try to predict toxicities with anti-PD-1 PDL-1 agents. Could we predict from a genetic profile who's more likely to have those side effects, and also do the same genes that we were looking at predict a likelihood of response? And that's partially based on the immunogenetics of thyroid disease. And we're trying to combine that. So I hope we can get back to that fairly soon. Our chief of medicine at Montefiore, Dr. Yale Tomer, is an expert in this area. And as an immunologic endocrinologist, he's been very helpful to our thinking in this way and to guiding some of our work. So I hope we can get back to some of that stuff. Also, we've been looking at, can we tell within just 2 cycles of treatment, very early on, within 6 weeks, who's likely to be benefiting from treatment and who is not? And is that a time early on to be able to make a change? And it's looking way beyond imaging, but also using patient-reported outcomes to try to predict these things very early on. So far, the results are very encouraging. So maybe we can get back to all of those when we have less COVID in our midst.